Hello, everybody, and welcome back to my channel. Okay, if you are new here, I am Modesta Phyllis, a Ghanaian nurse living in Saudi Arabia. So, this was a request video. I had a few people ask me for this video, so they were asking me questions that was asked during our interview. This is a request video. So, if you are new here, kindly subscribe, like, and share my videos. First of all, I want to thank everybody for your support. It's been really great seeing how you all support me and everything. I don't take it for granted, so thank you for those who share my videos, for those who keep commenting and everything. Anyway, sorry, I'm not really feeling well, but since this is a request video, I just decided to just do it since I have some free time. Okay, so let's go back to this. So during our time, the Ministry of Health came to Ghana and they came with representatives, doctors and nurses who came to do the interview at Accra International Conference Center. So at the moment, I know the interviews are mostly through Zoom meetings. That's what I know. But ours were face to face. So the face to face, he came in two phases. And we had the written one and we had the oral interview. So two phases, the written and the oral. I don't know for those who are currently doing the Zoom how theirs go, but I don't know, maybe. So ours, the written one, it was basically about 20 questions, MCQs. It's more something like something in the areas of nursing. Because I did nursing, so basically nursing. And then it was given. So the pass mark was around getting half or over half of it. So if you're able to pass, they'll tell you, okay, you pass and you can move on to the oral interview. So they asked our questions basically on Code Blue. I don't know if those in Ghana have heard of Code Blue, but if you have not, kindly do a bit of research about Code Blue. I'm sure you would have had an idea about Code Blue, even though we don't actively use it, the whole Code Blue in Ghana, but you've heard about it if you worked in an emergency before. And then, so we had about infections, yes, the use of catheter. It was MCQ. MCQs can be a bit, should I use a bit? It's not difficult, it's a bit confused because most of the time you try to choose the answer that is mostly nearest to it, because all the answers could be correct, but you have to choose the right one. You understand how MCQs were, even with NCLEX and all the objectives you've done in this, you need to choose the ones which is closer. Maybe your priority, the priority you're supposed to do first. So maybe you can have all the answers correct, but you have to choose your first priority as the right answer. So that's it. So we had catheter use, we had infection, if I can remember, we had fractures. Yes, there was fracture questions, right? There was something like the wound, yes, and then Code Blue, and then rapid response. So mostly you can have scenarios where maybe they will tell you, okay, if you're in an emergency and then maybe we have 3 patients, one comes with cardiac arrest, one comes with vomiting and diarrhea, one comes with maybe blood oozing or a cut. Which one are you going to attend first? So it's mostly in scenarios like how we do NCLEX. If you've done an MCQs question for you, you understand what I mean. So that was what our questions was about. So the pass mark was to get half of it. So after you are done with the exam, they'll tell you whether you've passed or you failed. Then you move on to your oral. And mostly the oral interview was about nursing. They'll ask you what you do where you work. And they will ask you certain questions. That was me, for example, the person who did my interview asked me certain questions that was in my exam. I think he wanted to know if I really knew the answers. He asked me a question about fractures again, which I gave him the answer. And then he asked me about my workplace, how many hours I do at work. We delve in it. So mostly it's about personal questions with the older ones. They ask personal questions: what you do at work, how is your hours you do, how you would deal with certain scenarios and all that. Yeah, like I said, it's not really something difficult. It's not really something very, very difficult. So you can pass. It's easy to pass if you read widely. Yeah. And then there is international standards of nursing. So this, I think I had that kind of questions. So if you can read about international standards of nursing, read about it. Yeah, and the rights of nursing, the drug administration, and all those things. Yeah. So basically, that's it. With the Zoom, like I told people in the comments, I don't know how the Zoom works because I didn't experience it. But this is my experience with the face-to-face interview. So yeah, that's basically it. It's not something really difficult. Like I have told a lot of you who comes to my team, it's not really something you should be scared. You know, when you are going for an interview, like I keep saying, get prepared. You should be prepared for any questions. As long as it's in your line of work, you should be prepared to answer it. And if you don't know, forgotten the answer, don't say no idea. You can't tell me you are working and you don't have, maybe it has skipped my memory a bit. Kind of it, they'll move on to the next question. You can answer. If you say no idea, basically you can't tell me you work the next and you don't have an idea about your own line of work. You like, I feel like if you give such an answer, it's like, oh yeah, doesn't speak well of you and your profession. So you can just tell, oh, skip me a bit. Yeah. So the person can go to the next question and come back straight. Or by the time you move on to another question which you can answer. Not like we are giving the interview for you to purposely fail just to test your knowledge. Yeah, and to know that okay, you are in the right frame of mind to work on patients. Yeah. So basically that's just it. So if you like these videos and every other videos I've shared so far, please kindly like, subscribe, and comment. And I will see you on the next video. Thank you so much. Bye.